Right now we're going to speak to Dr. Leyla Hannbeck, CEO of Independent Pharmacies Association, representing independent community pharmacies across England and Wales. Dr. Leyla, very good morning to you. Lots of talk about changing the way that we interface, I suppose, for want of a better word, with the NHS. A lot of people thinking that Keir Starmer's ideas of making neighbourhood hubs isn't really going to work. And a study this morning saying patients would rather see a GP than a pharmacist or a nurse.
Well, good morning. We know that patients want to see GPs face-to-face because over the past few years it's been very difficult to get a face-to-face appointment with GPs. But we also know that patients are highly satisfied with community pharmacy services, the health services that we provide, because of the accessibility, professionalism, and the fact that they can walk into their pharmacy without an appointment and speak to a healthcare professional about their minor ailments.
There was a time, I seem to remember some months ago, it might have even been under the Tories, where there was supposed to be more powers given to pharmacies so that they could do more for patients. Has that ever happened?
Yes, it did happen. And in fact, a research that was published by HealthWatch last week demonstrated that 86% of public could use pharmacy services, minor ailment services, pharmacy first as we call it, wanted to see more of it, and they were highly satisfied with those services.
Yeah, okay. And how has it changed to being running a pharmacy now then? Is it busier than it used to be? Because I remember talking at the time to people saying that's going to create a much bigger demand on pharmacies because people can't get to see their GPs a lot of the time.
So, Mike, I don't know where to start with this, but obviously as community pharmacists, we've had serious struggles with our funding because we've been asked to do more, and obviously the cost of everything goes up, and we heard about the national insurance and all the other costs going up, but our funding has not been going up as much as it should be. So we are struggling really a lot. But we are there for patients, and we are delivering those minor ailment services, and we want to do more and help our GPs for them to become free to see patients face to face as well. So, so we are here to help, but the government needs to put the money where the mouth is.
Yeah, well, they haven't got any, I'm afraid. They've spent it all, so I'm not sure if you're going to get any, but you never know. And can you now prescribe patients with drugs, or do you still have to get the doctors to do that?
Many pharmacists are now independent prescribers, so they can prescribe certain medicines, and it makes it easier because why should, for example, someone for a minor ailment go and see a doctor when they can pop into the pharmacist and see that? And that will free up our doctors and A&Es to see patients with more serious conditions.
Yeah, okay. Well, it's good to talk to you. Dr. Leyla Hannbeck, thank you very much indeed, CEO of Independent Pharmacies Association, representing the pharmacies across England and Wales.